I've never taught any of this stuff before. This is the first time I've taught it this way. So bring a pen. There will be recorded notes for this. We'll send you the video. We have the AI companion as well. So come all the way in the room if you can. So if you're multitasking, minimize some tabs. Um, oh, there's my recorder. Never mind. It's already done anyway. If you can, just come all the way into the room and you'll get the recording afterward. But today we're going to go over, I don't think we have an option anymore of how we see patients. I don't think that we live in a society now that is going to have things be simple. Between, as an example, 10 years ago, we did not have to worry about people being on their phones for 6 to 8 hours a day. Now we do, and all the health implications that come with that. We didn't really have to worry about the chemicals that are in our food and that are pervasive in the water, and essentially the pharmacological dependence that everybody has been indoctrinated into. Things were simpler as early as 10 years ago. So now when we're looking at these cases, and today is mainly going to be like a case review and how we get all the ecosystem to talk, get the ecosystem to talk to itself. So if somebody comes in for X problem on the medical side or the chiro side or even on the detox side, how do we educate, and one, our staff to be able to see these things, and two, how do we educate the patient so that they see the value in all of the offerings and not just coming in for essentially doing paper doll syndrome in our office. If you're not familiar with paper doll syndrome, it's essentially when you never heal the things that are going on inside of you and you keep dating the same person with a different face and having the same problems. So patients will run into that where they go to all these different doctors and essentially they are trying to treat the same problem with a different face telling them what to do, just with a single band-aid modality. And I think that's what's the dysfunction there is. It is, we're providing band-aid care if we just do the physical thing. We're providing band-aid care if we just do the chemical thing. We're providing band-aid care if people think it's all emotional. So the goal would be, how do I see this person as they have a complex nervous system? They have a chemistry that's dynamic, and no matter what phase they're in, as far as age, you can still help them. And then also, what are the tactical implications of how do I set up my systems and processes and procedures so that every single person that comes in here is going to be educated effectively so that they want to continue care and actually get the results they want. Because if they get the results they want, then they're going to go tell all their friends. So I had a patient, I'm going to pull up the notes here. I had a patient come in. This was in December. He's in his 60s. He came in because his wife recommended that he came in. He was having these chronic histamine reactions so bad that every single time that he would muted.
I take this, turn on my recorder.
You guys can mute yourself. I think everyone's muted. Yep. Okay. So he came in and he was in his 60s. His wife recommended that he came in. He was having histamine reactions over everything. When he would brush up against things, put on shirts, to the point where he was being consumed by the actual histamine reaction while he was at work, while he was at home. Let some people in. He's been to several doctors. They gave him steroids. He noticed a slight reduction, but it made his nervous system way worse. He was noticing anxiety. He couldn't sleep. He had GI issues after that. He was having chronic diarrhea, and it made his joints worse. He already had an existing hip problem with an inguinal hernia, and he said it would flare up every now and then to where his testicles would get like 3 times the size. He would get headaches. He's an entrepreneur. He owns, I think, 5 or 6 different furniture stores. So he works a ton. think I said he's in his 60s already. He's 80 pounds overweight. He has adult kids. He has grandkids that are young. So he wants to play with them. He has no exercise and he knows a normal diet. I asked him what a normal diet meant. He said he wakes up and he eats eggs and bacon and toast. Lunch is a salad from somewhere, and dinner is whatever his wife makes him. Could be steak and potatoes. It could be chicken and rice. So relatively, seemingly healthy chemistry, right? He has occasional groin pain from that inguinal hernia. He had mold exposure in 2019. He said he was living in black mold for a few years, and then he moved out of that house and sold it. He has not had the COVID vaccine. So we ran him through our typical protocol where I will look at their spine first and go through our 5-part series. I'll take an x-ray, I'll do nerve scans, do physical exam, do the interview, and then we'll have him draw blood at the end of the visit. And so I put together my report of findings and I saw what his nervous system was doing. And then we drew his blood. He came back 4 days later. So I don't know if you guys are familiar with blood labs and chemistry and reading them. One of the things that jumped out, and I have a picture of it here, his CRP, so his C-reactive protein, his measure of inflammation in his blood was 60. Above 3 is bad. 60 is freaking catastrophic. And this is after he was already on steroids. This is after he had been doing several things with different practitioners. He did a few IVs. It was just kind of piecemealing. They didn't really know what to do with them. So his CRP was 60. I was concerned this dude was going to have a heart attack in my office. So the primary goal, number one, is to regulate his nervous system. He was saying he couldn't sleep. He was saying he was getting more anxiety. He did have joint pain. And so we started adjusting him. To me, when we use our system, when I see autoimmune reactions like this, when I'm seeing global inflammation that's taking over the body, you stick mainly in the sympathetics. Sympathetics, as far as our definition, is going to be C5 to L5. I'm going to be leaving the pelvis alone. I'm going to be leaving the upper cervical alone, because if I start to do both of those together, that flies in the face of just nervous system stimulation as opposed to trying to nervous system stability, because something has become hyperactive and I don't want to cancel out what I'm doing as far as the nervous system care. And then what we recommended at first, so we recommended 3 different peptides. Number one, not 3, 4. Number one is BPC 157. So that one reduces inflammation, helps to grow new vasculature, helps with the oxygenation in the blood, will help to settle the GI tract. So that was number one. Thymosin alpha was another one, number 2. And so that one helps with the immune system, like T cell responses. That will be the difference in, we give this a lot to thyroid patients. We give it a lot to autoimmune patients and celiacs, just anything where there's this autoimmune response where they're having an overreaction to things, and it helps to stabilize it. Even to the point where I've had women with Graves' disease where their eyes are bulging out of their head and they just have all this pressure. And one of the things they notice is when they lay flat on their face for an adjustment, it's a lot of pressure in their eyes. I've put them on this protocol with a couple different other peptides, and it reduces their eyes. Like, their eyes do not bulge out of their head anymore after we put them on this protocol. And that's after they've been bulging for a decade or more. So we put them on thymosin alpha, BPC. We put him on retatrutide because he was 80 pounds overweight. He needed to lose a lot of weight. He had a lot of body fat, especially central. And when you see that central body fat on a male, that's a ton of visceral fat. And visceral fat is weird in the sense that the body will lay down calcium around it. And that ends up being one of the things that's tough to disrupt. That's why they tend to be resistant to just metabolic changes. So if I'm just changing their food and I don't really change anything else, you might lose some weight, but it's going to be very resistant just because of the hijacking of metabolism, and they're having so much inflammation. Essentially, that large central abdominal obesity starts to act like an ovary. It secretes a ton of estrogen and it's resistant to weight loss. So you need to do several things to destabilize that. The second one being tesamorelin. Tesamorelin helps with growth hormone, so it helps with lipolysis. And it's one of the only peptides, one of the only drugs ever, I don't even want to call it a drug, one of the only compounds ever that have been shown to reduce visceral fat. So when you stack that with a retatrutide where you're blocking the GLP, you're changing glucagon, you have a GIP agonist. So now with those four things that are happening with the body fat effectively just melts off. And he also had a testosterone level, I think, of like 180. It was in the hundreds. So his nervous system was hijacked, his chemistry is hijacked, and he really just doesn't have good habits. His behaviors, he behaved his way into this. People don't get sick, they do sick. They don't get injured, they do injured. And this was his way of materializing this illness. Was just adjustments going to help him? Maybe. Might have helped his headaches and his groin pain a little bit. Maybe reduce his inflammation. Was just the chemical stuff going to help him? Yeah, but it's got to be done right. But when you marry those together, and I think this is the way of the future, and I'm not the only one that's doing this, when you marry these together, the results that you're going to get are profound and are necessary in our society now. If you are only doing one, you are missing. And the offices, I think the offices that are going to do both and do both at a high level are going to be the ones that dominate in the next 10 to 20 years. So we put him on this protocol. Of course, we changed his diet. We had all these checks and balances. I get a continuous glucose monitor for him because I want to see what his blood sugar looks like when he's sleeping and when he's eating throughout the day. It's kind of an accountability measure. So when we start talking about the art of behavior change and what are the things that are actually going to move them into action and keep them motivated, one of the things would be what can they see visually, what keeps them engaged, and also just how you present language is going to be important too. But if I can keep them engaged with visual cues, with these check marks beyond just taking new x-rays, beyond just checking them when they're in my office, it's going to keep them motivated long enough that they can essentially create a new identity. Because their identity right now is rooted in the fact that they don't feel good and people don't really know what to tell them. So we're inventing a new identity of like, I can be healthy. Health does not come from a pill, it comes from inside me. I can be supported. And I think all healing must happen in community. So structuring our offices and structuring the offers in a way where they understand that when they're here, it's work and also that they're supported. The last thing we did, which is the bigger one, and not every office has this, that's why I didn't want to talk about it too much, was we put them on EBU, the extracorporeal blood oxygenation ozonization. So if you're not familiar, pulls blood out of one arm, filters it in a dialysis filter, pushes ozone and oxygen into it, and then puts it back into the other arm. That, because of his mold toxicity, we grabbed a urine test for him because I just wanted to see, just for fun. We already knew he had to strip off a lot of weight. We already knew he had to reduce his inflammation. But with that exposure, how much was it actually affecting him? And he had pretty high levels. It wasn't catastrophically high. You can tell he wasn't around it anymore. But you can tell he had mold exposure that was still settling in his body. And he had some environmental toxins as well with some metals. So I gave him those peptides, put him on EBU, and we started adjusting him. Over the course of 1 month, this guy, you wouldn't even be able to recognize him. So we saw him in December, and this is even with limitations with food. When people travel, they go see their parents, or in his case, his grandkids. He wasn't perfect. Like, he was the furthest thing from perfect. He even told me, he's like, I feel bad. I'm not really following what you're telling me. And I'm like, dude, as long as we just 80%, how can we stay consistent 80% of the time and you showing up for you? So he shows up in January. We check him. He's still wearing the continuous glucose monitor. We're noticing his blood sugar starting to come down as far as his resting. His resting blood sugar was like above 110. It would spike up at night, which is terrible. And then he'd lost about probably 10, 12 pounds. But his latest, as of this week, it was on Monday when he came in, he's lost 70 pounds. 70 pounds. His CRP is below 2 and his histamine reaction is pretty much gone. It'll flare up every now and then. I think when he travels is when he notices it. He says when he goes into certain hotel rooms where he has a mold reaction, he says he can smell the mold, which is very common if you've had mold exposure. So I think that mold actually did more things than his blood or than his urine reveals. If effectively, if that's the only thing that's flaring him up, that might have been the cause. And then everything piggybacked on top of that. So we put him on these peptides. He ran them for about 3 months, weaned him off, stabilized his blood sugar. but look at the result he got. It's not me. It's these things when applied correctly with an environment, with an ecosystem that actually supports the patient, that actually addresses. They have a nervous system, they have chemistry, and they actually need people to support them because they're doing so many new things in a hyper-stimulated society. If he's on his phone or on his computer working 6 to 8 hours a day, we need some sort of reinforced reminder that, hey, we're doing things different from now on. Why does glucose rise at night? Some sort of metabolic dysfunction. So typically you're going to see it go down, and you'll see it go down with the heart rate too. And that's how you know they're getting into deep sleep. But around midnight is when his blood sugar would just start to gravitate upward. It'll go from like 100 to 110 to 130, 150. And you'd wake up really hot too, around 2, 3 in the morning. That's one of the things that will reveal to you with a lot of patients is if they say, I wake up hot and sweaty. Again, there is premenstrual and menstrual that there's an exception to this when it's estrogen. But if people are waking up between 2 and 3 in the morning, really hot and sweaty, that's blood sugar issues. And typically what it is, if they're going to sleep and they've had a high carbohydrate meal, so you have your blood sugar. If I eat, I don't know, let's just say rice and potatoes, things that you would think would be fine on the blood sugar, even though they're not. It's going to spike up the blood sugar. If I go to sleep and I sleep in a perfectly dark room, no alarm, no light, I am naturally going to wake up when my cortisol hits its peak. So when I'm asleep, the longer I'm asleep, my cortisol is raising. And what will happen is when I jack my blood sugar and then my cortisol is naturally raising, starts to fall and try to correct itself because it doesn't want circulating blood sugar or a high amount of circulating blood sugar. This starts to fall as this is raising. And if this is too sharp, what will happen is the brain reads it as like alert. We're having a hypoglycemic moment. There's trauma, and it will wake that person up. And usually they're going to be hot, sweaty, and having a bunch of other issues too. Could be GI issues, joint pain. But that's usually what you'll see with blood sugar issues. But for his, it was just going up at night. Wish I had a better answer. Let's see, what else did I throw in here? So he's lost 70 pounds. His CRP is back to in the twos. We want to get it to sub-zero, but I think we have more work to do with the EBU. And then he did 3 rounds of EBU. So typically with a protocol of EBU, one cycle, according to the protocols that they give out for these, one cycle is going to be 3. And how this unit is utilized, it's a low dose and then 2 high doses, because there are dosages with the amount of filtration and the amount of ozone that you actually push into the body. And so that'll depend on the amount of detox effect that they'll have. And you'll want to make sure you brace them for that, because you got to give them binders. They could get some Herxenheimer reactions. That's when they detox. They'll feel like they have the flu. And he had that for the first one, but the second 2, he said he just felt better. When we combined all these together over the course of, I mean, it's been 5 months now, but really over the course of those first 2 months, he had this dramatic change where he just kept saying, I feel like I have my life back. I actually feel better than I did 10 years ago. And those are the types of results that build a practice. Those are the types of results that if we can install that ecosystem into your practice or install into your future practice, that's going to be the difference between it being a multi-7-figure practice versus doing 20 to 40K a month. And it's not all about the money. That's not the point even. We like using money as a measurement because that is a measurement of service rendered. It's essentially how much good have you put in the world. You can measure it to the penny. So if my revenue is going up and I'm practicing honest business practices, if my revenue is going up, then I'm serving more people at a higher level. That's the whole point. And it's not the money that we want. It's essentially the feeling of what we get on the other side of that service. So when you have more finances, when you have more financial freedom with your family, you have more choices. It's just freedom of choices. I can have the house, I can have the car, I can take the trip, I can have the time off, just because I'm serving at a higher level. And when you serve at a higher level, no matter what, you are rewarded. Always. Sometimes it just takes time. So today, I want to go through some peptides that I think are very effective and that marry very, very well with chiropractic care. And if we leverage them effectively and have the correct conversations at the correct times, this is how you turn a patient that's only coming in for physical care into a patient that becomes a patient for life. You become their doctor for life because you actually have answers for the things that they're going to be running into in our modern society. What are the problems we're going to see now? Largely chronic inflammatory behavioral ones. It's less of of course, there's car accidents, of course, there's slip and falls and sporting injuries. But we don't get sick, we do sick. We don't get injured, we do injured. If I'm doing things that inflame my chemistry or destabilize my nervous system all day, and then I have some sort of impact, now I'm more likely to be injured. I had a mentor tell me this. It's a weird saying, but I think it holds up. If you were to take all of us to the top of this house, it's a two-story house, and we all had our hands and feet bound together, and we were all thrown off of the house at the exact same time and landed in the exact same way. Thrown the same, landed the same. We'd all have completely different injuries. Why? Because we all have different inflammation patterns. We all have different nervous system adaptations. We all have different posture. We have prior injuries that were taken care of or not taken care of. So essentially, you are teed up to have the specific type of dysfunction that you could potentially develop later on. And if the body is meant to compensate, because that's what it does, if it's meant to compensate until it cannot anymore, that failure point is when you want people thinking of you. You don't want them just thinking of you when they sprain their ankle or when they hurt their back. You want them thinking of you when they get colds, when they have skin rashes, when they had a car accident, when their kids are developing and they're having behavior issues. You want them thinking of you. Because if you are trained effectively and you have these protocols and you've properly integrated, then you have answers for these. So the goal would be, how do we install these systems at a high level, train the people around you at a high level, because you can't do it all yourself unless you have an MD or an NP in your name. But even then, I'd say disperse the work. So you're not meant to do things alone. You're meant to work on a team, and anything worth doing is done together. It's the whole, if you want to go fast, go alone. If you want to go far, go together. Holds up. And also the third aspect of that, if you want to do anything meaningful, you can't do it alone. We need each other. Peptides are not new. They've been around since at least the 70s. The first people that are documented that were using them that I have found, at least in this type, in this scenario, insulin's a type of peptide. It's been around a long time. But performance, as far as performance enhancement, recovery enhancement, longevity intentions, was about the 60s, 70s by the Russian military and the Olympians. So they found some compound called peptide bioregulators. And peptide bioregulators were interesting because it essentially, think of it as upgrading your hardware. That's what peptide bioregulators are. We're not going to talk about them today, but let's just use this. Peptide bioregulators upgrade your hardware. What is, as far as the computer itself? Peptides, as in the ones that we're going to talk about today, upgrade your software. It helps the output. It installs better programs so things move faster, they move more efficiently. But you're only as good as the hardware. That's why we talk about the nervous system first. That's hardware. The peptides themselves are going to be software. And that's why I think it aligns so well with the holistic space, because when you talk about things like testosterone replacement therapy, and I'm not saying not to do that, because we live in a society now where the average 30-year-old has 300 or 400 as far as their level, and the average woman has between 10 and 30. When men, we should have at least a level of 900 if you want to actually be not on the road for losing muscle mass, losing brain mass, setting yourself up for prostate cancer. And for women, we want to be 90. If we want to be muscle sparing, we want to enhance cognitive function, enhance energy, enhance your immune system. There's a whole immune system component of testosterone. So I'm not saying TRT is bad. There's a place and there's a space for it. But what I like about peptides is, unlike testosterone replacement, where it shuts down your natural process of it, peptides only enhance what is. It tells your body to perform at a higher level, or it detoxes at a higher level so you can perform at a higher level. And then from there, now you start to access health because you essentially you're getting the things that are blocking. What are the three things that block health? Physical stress, chemical stress, mental emotional stress. Congratulations, you're human, you get all three. So this would be the way that I start to remove the chemical stressors that we have. All right. So number one, BPC 157. I'm sure if you have watched YouTube in the last 2 years about anything health, you've heard this name before. Interesting one. It decreases inflammation. So the story, as it was told to me, is so this is a compound that's located in the gut. They found it, they pulled it out, synthesized it, put it at a high level, and put it back in the body to see what it would do in animal models to the GI tract, specifically to those with chronic inflammation, Crohn's, ulcerative colitis type symptoms, IBD type symptoms. And they noticed that when they put it back in the body, the GI tract got better. It decreased the inflammation. Like, hey, there's something to this. It started growing new vasculature. It increases vascular endothelial growth factors. So essentially, you will grow new blood supply. That's also one of the things too. If you look at the resources, they say don't give this to people that have cancer. My challenge to that would be, isn't the issue with cancer low oxygenation? So would you actually be hurting someone if you're helping them grow new blood supply to get more oxygenation going? This is more of a theory question. I have no science to back that, but we do know a low oxygenated state promotes cancer. That's it. So grows new blood supply, decreases inflammation, eases the GI tract. They found it helped the stomach a lot. They said, okay, great. Is there other applications? And they started noticing that it was floating around and starting to repair joints systemically. So I can put it in my belly and it still repairs my shoulder a little bit. I can put it in my leg and it still goes up to my neck. It works decently well for spine. That's not my go-to for spine. These are great for extremity injuries, specifically acute extremity injuries. Someone sprains an ankle, tears a rotator cuff, injures their groin, something on the extremity line, BPC works great. On spine, it's hit or miss because I think it's just the way that it accumulates swelling is so much more. And then you have all the different components of pain that you go with the spine. You have nerve pain, bone pain, soft tissue. It's a lot more complicated. At least that's my assumption. So they started noticing that was traveling around systemically and helping with tendons and helping with ligament repair. Interesting. Okay. I wonder if there's other applications. And the most recent one is that they started noticing that it was crossing the blood-brain barrier. So the military is using it on a lot of studies now. This and ibogaine seem to be the thing that they're studying the most. And blast injuries specifically, so concussive injuries, traumatic brain injuries that have affected the brain, BPC has been being used as an adjunct for decreasing that brain swelling. So if you have people that have had concussions, traumatic brain injury, any form of like impact that is older as well, can still help it. And the protocol for that would be, it's not rest, it's actually a lot of movement, balance work, B complex, magnesium, omega-3s, and then you would do some BPC, and cerebrolysin is one. That's just the concussion protocol that we use. So very, very interesting compound. This is a conversation with every single patient that comes in, honestly. If they've had an acute injury, if they have gut issues, if they've had inflammation that's in a joint that's not going away, and we've changed their diet, which is a little rare, but it does happen, then this is a conversation. Hey, we're affecting this physically, we're affecting this neurologically, but I think the chemistry is still overtaking you right now. Are you open to having a conversation to see what we could do to add to what we're doing? Most times people say yes. That integration, I'm not saying you do it. I'm saying you have a nurse practitioner or a PA, but you initiate the conversation. Hey, are you open to, you're getting a micro agreement there. And we're going to start talking about behavior stuff. Hey, are you open to having a conversation about trying something new? Yes. Okay, great. And then you start to educate about it. If you just become an educator on this stuff, people get excited about it because it works. It's very interesting. So the next one is that's also very good with, well, one last thing with BPC. You can put it subcutaneous. If you put it subcutaneous near the site of the injury, so if they have a shoulder injury near the shoulder, if you have a knee near the knee, that's great. When you have, like I said, an acidic environment, when it's very swollen here, it acts kind of like a vacuum. So if I put it near it, it pulls it deeper into the joint and you're more likely to get a better saturation. It could be a better effect faster. But in the long term, it's all the same. So that's subcutaneous. You can do intravenous BPC, and we do this according to a concussion protocol, a series of IVs that we use with cerebral lysin, TB500, BPC, and some supplements. So we'll get cheerleaders that land on their head, or we have a lot of jiu-jitsu athletes that land on their head or get punched in the face. So those traumatic brain injuries, we get them on this specific IV therapy regimen that gets them back. And one of the things we have them do is get rid of their phone. So looking at blue screens, I think, is one of the most detrimental things for a traumatic brain injury. If we can get them off of their phone for a few days, it's the difference between them being back to work out and play within a couple weeks versus a couple months. It's bananas. So we get them on this series of IVs, but a part of the IV is BPC 157. And typically the dose, when you're doing it just subcutaneous in the muscle, in the below the skin or in the muscle, is about 250 to 500 micrograms. When we do it in the vein for an acute head injury, it's 10 times that amount. It's anywhere between 2.5 milligrams to 5 milligrams. So you get this blast of BPC, and that's going to be one of the things that calms down that inflammation a ton. We call it the golden hour. If we can get somebody within the first, I'd say 48 hours with an acute injury, and people have walked into our clinic with like hospital bracelets from having a head injury. They'll walk in and within about 48 hours of that injury, if we can adjust them, if they actually have a physical injury, and then get them started on this, it cuts healing time in half, if not more. So it's bananas. If you can just get ahead of the swelling, that swelling isn't allowed to settle in and really create that acidic environment where you're dealing with all the cytokines and the immunological response, then it's going to change things a lot. All right. Next one's going to be TB500. This one's interesting. I'm not going to get into the Dr. E's about it because I'm just going to talk about it the way I talk about it with patients. This thing increases protein synthesis. So if you want to put on muscle mass, if you want better muscle recovery, tendon recovery, that is what this is primarily driven for. This is why it's paired with BPC a lot. So if I get the BPC in there, I'm decreasing inflammation, I'm increasing angiogenesis, I'm growing new blood supply to help with that injury or just help with muscle growth. And then I do the TB500 to help with increased protein synthesis. Now the person is going to, their recovery is exponentially higher. And then also they're going to be putting on muscle mass at a higher effect without doing things like TRT or growth hormone. So again, TRT shuts you down. Growth hormone, as in synthetic growth hormone, shuts down your body's ability to make growth hormone because the body's very efficient. The body's lazy. It doesn't want to utilize energy it doesn't have to. So if you are already giving it the things that it would otherwise have to work for and use energy for, why would it work for it? But these peptides, as in software upgrades, and the next one we'll talk about is a growth hormone releasing hormone. It actually tells your pituitary to secrete more. So it actually increases the function in a healthy way, rather than putting in the artificial version. And with growth hormone is interesting because if I do synthetic growth hormone, it works, and you eventually start to develop antibodies to it. So you continually have to increase the dosage that you put into the body with growth hormone over time, and then you start to grow your teeth and your forehead gets bigger and your kneecaps get bigger. If you ever want to see what that looks like, look at a picture of what Sean Merriman looked like when he first was drafted in the NFL, and then look at him for his last year in the NFL after he got busted using growth hormone and TRT. His forehead is like 3 times the size. So that's another thing too. When you're messing with growth hormone, you're not just growing. It's not just a protein accelerator. You're growing everything. You're growing your bones. You can grow your teeth. You'd have to take a lot of this, and I've never seen anybody overdose and take too much of these peptides for growth hormone, but it happens all the time with athletes when they're taking the synthetic growth hormone. All right. So TB500, great for musculoskeletal injuries, opens up that conversation. Hey, Cindy, I know we um, injured your knee during that accident. We started doing the BPC. I think this would actually help you a lot as well. That way you can get back to tennis. That way you can get back to hiking with your kids. That way you can get back to insert the thing that's important to them. The conversation's always about them. It's you continually getting to know exactly what they need and how you can deliver those needs with the things that you have. But it just comes from educating and then knowing these are available. All right, next one. CJC, ipamorelin. So this is a growth hormone releasing hormone. This is going to, so growth hormone's interesting. It's pulsatile, where you're going to get a little blip of it in the morning, and then you're going to get a little blip of it at night when you're going to bed. This is the only one that you want to take in a fasted state. You do not want things circulating in your blood. That's going to inhibit the amount that you can actually absorb. This helps a lot with fat burning. So women that do not want to take a GLP because of they think it's cheating, or they hear all these scary stories, which I'm not a fan of GLPs for everybody. But if they don't want to go that route, this is a route that they can increase lipolysis. It'll help with their muscle mass. It'll help with their immune system, even helps with sleep. I have a lot of women that will choose this route and actually get really good results because growth hormone helps to lose weight and it helps to retain muscle mass. And even though something in the order of like 60+% of the United States is overweight or obese, and that's like how it is for most of the developed world, Australia, UK. Growth hormone releasing hormone. This is the only one or one of the few ones you're going to take in the morning and at night. So if people do not like needles and they don't like poking themselves, this would not be where I would reach for first. Um, They'll notice weight loss, helps with their immune system. Like I said, I've given women on Graves this with that thymosin alpha 1, and it actually made it so their eyes were not as bulgy. It actually helped them lose weight. It's a very interesting peptide. All right. Next one is MOTS-C. This is one of my other favorite ones. It's less talked about. It's very expensive. So that is going to be one of the hitches in you offering this. It will depend on the income of your patients, but if the value is there and the results are there, educate on it and they can choose themselves. MOTS-C is interesting because as we get older, I'm sure you've heard people say, like, we are as young and we feel as good and we have as much energy as we do efficient mitochondria. As we get older, we have less mitochondria and they are less efficient. MOTS-C will help you grow new mitochondria, and it will help the mitochondria you do have become more efficient. I think it's super important. So when you use this, I'm usually using it with some sort of fat loss. I'm usually using it with some sort of metabolic issue. They're chronically fatigued. There's a couple other peptides, Cmax and Selank, that can help with that. Cerebral lysin can help with that. But this one I think is very important because if your mitochondria are sick, you are sick. And this is going to be one of the ways, as long as you're stacking with taking care of their nervous system and also taking care of their diet, you're going to help their mitochondria exponentially. I had a couple different people on this. They looked younger after 4 months. Like they literally looked like they aged in reverse by like 5 years. I asked her, I was like, hey, did you go get a skin thing? There's this dermatologist that's near me. She does something called a Tixel. So, and a bunch of patients that came from her. I was like, did you go to get a Tixel in the last like month or so? And she's like, no, not at all. I've just been doing this. So it works. It's very interesting. Um, It's one that you do 3 times a week, so less needle fatigue. You're going to operate in the realm of like 15 milligrams a week, so 5 on Monday, 5 on Wednesday, 5 on Friday, and usually you would put it with either like a CJC ipamorelin or maybe a retatrutide. So it's going to help with weight loss. It'll help with energy consumption, and overall the metabolism just heals in my mind. Alrighty. All right. And the last one I'll talk about today, this one just finished phase two. I'm sorry, it's just finished phase three trials. Um, According to Huberman, according to the other people that I've listened to, this might be the first $1 trillion opening drug. Because, like I said, there's 60 to 70% of people in the world are overweight and obese. This is probably the closest thing I've ever seen to a magic pill, like ever. Um, that retatrutide, it hits 3 different angles for weight loss: glucagon, GIP, and GLP. So it's going to help with the appetite suppressant, helps with the glucagon, with the fat storage and mobilization, and then the GIP pathway. So those all three together, I'm seeing people with, we see a lot of operators that have uncontrolled type 2 diabetes because when they're exposed to chronic stress over time, it blows out their thyroid and blows out their metabolism. So even though these guys work out every single day and eat very clean, just because their hormones are so disrupted because of all the chronic stress, their cortisol is way high, their blood sugar is super uncontrolled. We have this guy that his A1C on average was like in the 7.5 to 8.1, and he ate clean, worked out 2 hours a day. You would think he would be healthy, but he did have all this swelling. He got on this himself. I didn't even recommend it. And the most recent time I saw him, he lost like 20 something pounds. All the water weight is gone. He said his A1C is down to 5 for the first time ever. This thing works. It's crazy. So on average, people are losing 1/5 of their body weight that have it to lose, that are on it in these trials. Um, you can get it from compounding pharmacies. I think Eli Lilly has the patent on it. So hopefully compounding pharmacies continue to still make it. Sometimes it goes under a different name. But when you're utilizing this with like a MOTS-C and helping their mitochondria, with if it's an older gentleman and they have that really hard belly that's like a giant ovary with all the calcium visceral fat, if you're using the retatrutide with the tesamorelin, that's going to help to wipe that out rapidly. So these all work at a really high level. It's a matter of you learning the chemistry, you learning how to tie it into their blood work and making it about them, and also tying it to where they want to go. One of the things I've noticed as I've worked with doctors is we get so used to just talking about what we do and how we do it. They don't care. No one cares. They don't care about you. They care about themselves. And they care that they're making the correct decision to be working with you, and the correct decision to be working with you to get them to where they want to go. So it's more of a vision thing. That's why when people come in and see you, crafting language in a way where I'm not focused on them feeling better, because a lot of times they're not going to leave the first few times feeling better as far as on the physical side or the chemical side. This stuff takes time. You're turning the ship. But if they leave feeling uplifted, it's a really important thing. This is how I train all the doctors that work with us and train the doctors that I coach. If they leave feeling uplifted, as in imbued with the belief that they're making the right decisions and that you have their best interest, then they will continue to follow the thing that you give them. And they're more likely to refer other patients. Because if you make it just about pain, or you make it just about your x-ray, you make it just about their blood work, then if things don't change as rapidly because they have the attention span of a goldfish, because they literally have a 6-second attention span, they're not going to refer anybody. And they're not going to stick with you long enough because they're not going beyond what circumstantial discomfort is. Life is not a game of circumstantial comfort. It's more of a game of like spiritual evolution and consciousness escalation. That's a whole nother topic. But if you can help to get them to a place where they believe that you can help get them better, because a lot of times they don't believe that they can heal. They believe that you believe you can help them. And then you have the answers, as in like roads for them to choose. Now you've made it profitable, you've created a proper system so that it's all integrated together, and you've kept a patient actually on the road of health. You've provided a service long enough at a high enough level enough to be compensated. You will be compensated exponentially more, and they will go tell all their friends. I have a lot of doctors that worry about when I had this conversation twice yesterday. They're like, well, I just do chiropractic. I just do PI. Like, where am I going to get all these patients? Like, where am I going to get all these functional medicine patients or regenerative medicine patients? I'm like, what do you mean? Like, literally everyone needs this. It's just a matter of you starting to talk to your existing patients. Like, hey, Cindy, we have this new practitioner in here, and then you being a champion for them. And then you being bold enough to start to learn new things so that you can invite them into your practice and build this ecosystem so you can help them at a high level. The patients will come. They always come because when they do come and they get a result like that, one patient will go tell 10. I don't know if you guys are familiar with paid ads or working with like a JV venture partnership, or maybe you purchase cold leads and you've had somebody call them. Like, you pay per lead, and sometimes it's $10 to pay for someone's contact information for you to just try to call them. Sometimes it's $250. It just depends on where you're getting them from. And there's no certainty in that they will do business with you, that they're qualified, that they believe what you believe, that they even want help. Like, there's no certainty in that at all. And you're paying money for it. The patient that becomes a raving fan has nonlinear growth for the practice. They can go tell 10 or 100 patients, and it's free. You're getting paid to get new patients. So, in a way, investing that 10% more, that 10% more energy or 20% more energy to go learn these things, hire the right people, install the new systems will be how you grow your practice exponentially. So much so that I would even say paid advertisement is not even necessary. I'm just now doing paid advertisement for a very specific thing, like 11 years into this, because if you just get the result and you provide that uplifted feeling over and over again consistently with the right systems, and it just naturally grows. So you can grow well over $1 million practice just by referral. And as soon as you get to 1 million, and again, if you're alone, if you have multiple doctors, you can go to a couple million just referrals. And then if you want to grow it more after that, you start getting the flywheel of SEO, paid advertisement, organic content, and you get all of that up there so that you're unified in your brand recognition. And now they can see you on, it's called omnipresence, YouTube, Instagram, your Facebook. They have maybe your blog online for your actual website. So you're in all these places. You create a positive flywheel. So now that people can encounter you at different places and you're saying the same messaging. Talking about nervous system care, talking about chemical care, I'm talking about how systems, the body operates in systems, and it's not complicated. I talked about this last time. Complicated means it's like a car. I can swap things out, but it's mechanistic largely, but it's complicated. Complex is like the human body. I cannot change one thing without changing everything. Think of acupuncture. How do you put a needle in your toe and affect your heart rate? So we're dealing with this complex system. How do we educate our patients effectively to know that, hey, there's nervous system care, there's physical care, there's chemical care, and you're in an environment where this community is meant to reinforce your behavior change, your habit change. You are becoming a new person. So I want this new version of you to not even recognize the old version of you. If we're doing the work correctly, the version of you that entered into this year doesn't make it out alive of this year. We want you to essentially like let those old habits die, that old version of you, those old beliefs die, so that you can be this new version of you. Every single person that walks in your office wants to be something else. That's why they're there. They're not there to fix their low back. They're not there to fix their headaches. They're there because of who they become after those things don't exist anymore. They want to be a more present mom, or they want to make more money and they're an entrepreneur and they can't think straight after 2 p.m. Like, there is a version of them, an idealized version of them that they have in their mind that you get to help them become. That's why I think this stuff is so cool. Like this, you get to do this work at a really high level and watch people become different people. So much so that their friends are like, dude, what the hell are you doing? Like, I have so many people that they've lost 40 pounds and they look like a different animal, and all of their friends show up because I don't know what you do here, but if he looks like that, can you make me look like that? Yeah. Like, it's cool. It's really fun. So that would be what I hope you guys take away today is if I want to increase the dollar signs on people, not on people. If I want to increase the dollar signs that I receive, I must increase the magnitude of good that I deliver and the amount of people that I deliver it to. And I have to be um, well informed. I have to be well systemized so that everybody talks to each other and has that high communication capability with each other and also with the outside vendors. If someone orders something, like, this is a lot more complicated than just ordering an adjustment. They're not just going to walk in and adjust their back and then walk out. Now I'm crafting thoughtful protocols. Maybe they're wearing a continuous glucose monitor that I can check in on. We're tweaking their diet. It's a lot. It's more work, but also the compensation is way more. The last thing I was going to go over today, and then we can do a Q&A at the end, is I was going to walk through exactly what it's like to come into our office and from either avenue, and then how we communicate to the patient over time, because you don't want to bombard them with everything on day one. How do you communicate with them over time the value in talking to the other practitioners in the office? So, since I think everyone in here are chiropractors, let's take it from the chiropractic side. So they've come in, had some sort of physical injury, physical motivator to come in. Pain is a great motivator. It's usually the last to show up and the first to leave. So that's why we don't want to make pain the only thing that we talk about. I talk about adaptability a lot. You wouldn't get sick if you had high adaptability. I'm hearing myself now. Okay, we're good. You wouldn't get sick if you had high adaptability. You'd be less likely to get injured. You wouldn't get injured. Who's practitioner? Is this training farm nutritionist? I mean, we have nutritionists that I work with, PTs, MDs. If you want to learn this, you can. You would just need a medical director. Um, Probably what I was getting at. So they come in, they have some sort of physical injury. Let's just call it a knee injury. And adaptability. If you're able to adapt to the stresses in front of you, the seasonal change, if you're able to adapt to travel, dietary change, hormone change, activity change, that means your body's pretty healthy. It's the failure to adapt that ends up being the problem. So everything that we're doing is meant to increase your adaptability. We stabilize your nervous system, we stabilize your chemistry, we reinforce your sense of well-being and your sense of community, and then you watch the person transform. So the goal would be we have that three-pronged approach. So they're coming in on the physical side. Okay, and we're going to take us through our process. And everybody has their different process and how they look at the body. Some people do muscle testing. Some people take x-rays. Some people use nerve scans. Some people just do physical exam and orthopedic exam. Do your thing. And try to be as specific as you can. I'm trying to be specific and find the real problem. Okay, let's just say it's this part of the spine. It's this part of the shoulder that's bothering you. Let's get you adjusted. Let's get you doing these rehab things. That's step one. It's your passive portion of care. So I always break it down into passive versus active. Passive is me physically doing something to you, and you largely just resting and doing rehab things. Ice, compress, elevate, drink water, don't eat a lot of carbs. Then there's the bridge to the active care. And I would say peptides and those are like at the bridge of that, not quite at the very end of active, but it's like at the bridge between passive and active. So there could be an adjunct with passive or really accelerate the active. So I'm taking them through this process. I'm getting their acute inflammation down as long as it's easy to get down. And then I'm going to start having the conversation. Hey, Cindy, after we fix this shoulder, what's next? Like, what do you want to do? Like, is it preventing you from doing anything? Is it preventing you from being anybody that you want to be? What are the things you would like to do now that you haven't done in a long time? Or my favorite one is like, I'll have a pen. I'm like, here's your magic wand. Your life is perfect in 5 years as far as what you can look and feel and do. What are those things? And then you're just like, I want to go on hikes again. I want to travel again. I want to not have migraines so I can be present for my grandkids. I want to insert whatever. One I had earlier this week was, I want to get my menstrual cycle back because I don't have a sex drive. And she's like 45. And I was like, well, I'll do everything I can. Like, well, let's get your hormones stabilized, get your blood sugar stabilized. There's probably a nervous system component. But if you just ask that question, they'll tell you exactly what they want help with. And then you know what to talk about. It's just being able to have those things to draw from to be able to talk about it. So, magic wand, love saying that one. What do you want to, how would you want to look? What would you want to be able to do? Who would you be in 5 years if everything's perfect? And they'll start to tell you. Is that great? So we've resolved this X problem, this neck problem, this shoulder problem. After that, what I want to do is let's get some blood work. Let's see what's going on in there. That way we can actually see, like, hey, is there some tweaking we need to do? Is there some food sensitivities? How are your hormones holding up? And people like near 99 out of 100 are like, yeah, hell yeah, that sounds great. People want to be cared for. People want to be not told what to do, but they want to be led. They want to be guided. So they need help. There's so much information now, especially with ChatGPT and all these AI models. Like they're plugging in their own blood work and they're finding out all this information, but it's not enough. We're beyond the information age. The information age is gone. Now we're to the place of, at least I think it's the oratory phase. It's how well can you speak about something? Because when you speak, you want to move into action and you create. It's not enough to know. You got to know how. You got to know how to do the things you actually want to do. And that's where you come in. So information isn't enough. Don't worry about all this AI stuff and that they can do Dr. Google because they still need you to lead them. So the goal would be we ask them what they need, we fix their problem, we ask them who they want to be, we get more data, and then we deliver them what they need. And it can be the practices that I work with work on several different iterations. There could be a membership model, which I think is great, which if you want to talk about the investment standpoint of eventually selling it as an asset, that's going to be one of the strongest. You can do high ticket therapies, which are great because now instead of selling two, three, $5,000 things, you're selling 10, 15, $20,000 things. Great for cash flow. Just make sure it's still profitable. Um, but it's a lot more than just your 20, 40, $60 adjustments because there's a lot more value you're exchanging. But there's this ascension model, like this graded ascension model where it's like they're coming in for X thing. You solve that at a high level, and then you get the permission to help them at this other higher level. So I talk about this a lot to the doctors that I teach. We'll talk about it high level today, but what is the quickest way? Well, before we do that, what percentage of your personality and your day to day do you think exists in your conscious versus unconscious mind? According to the numbers, 95 to 98% of your personality, your daily habits, behaviors, beliefs are unconscious. And they were largely formed before the age of 9, between 7 and 9. So your personality, the thing that you think about yourself and your beingness was formed way earlier than you ever had a say for. So there are some things in there that don't serve you. There's some things that are health promoting. There's some things that are not health promoting, relationship building versus relationship breaking. The goal would be you train yourself and you train your staff to fire as much information into someone's unconscious mind that helps them feel more empowered, that helps them believe more that they could be healthy, that helps them do more relationship building things, that helps them have more agency in their life. As an agency is they make better choices. Maybe they choose gratitude a little bit more. So the goal would be, and if the brain in our modern day, because of phones, because of computers, because of constant hullabub running to thing, if the normal brain is operating at 75 to 85 miles an hour, how easy is it going to be to If it's a car going 75, 80 miles an hour, if I'm trying to throw a baseball into that car window, how easy is it going to be when it's going 75 to 85 miles an hour? Not very, right? So the goal would be, how do I slow someone's car down enough? How do I slow their conscious mind and their unconscious mind down enough? And there's ways to do this, that I'm able to fire a lot of information into their unconscious mind that actually makes them believe that they can be better, that they can have better, they can make better choices, that they have more certainty, that they are supported, and that people can be on their team as opposed to always waiting for the next shoe to drop. So the goal would be, I'm able to slow their car down to 5 miles an hour or 10 miles an hour, fire a bunch of information into their unconscious mind while they're in my office, and maybe even after. That way they continue to do the things that are life affirming for them. And there's ways that you can structure language that way. We learn through experiences, we learn through language, but language formulas that actually access the unconscious mind. I'll give you three. This is from marketing. Literally, the marketers have figured it out a long time ago. The nephew of Freud, Sigmund Freud, was one of the main, well, he was the inventor of propaganda. But the three things that are from this guy, his name is escaping me right now, but that he taps into in his book, what are the three ways to unlock the unconscious mind? Through shock, and like them actually being scared of something. If there is a movie on TV and the bad guy is holding a gun up and it's this big tense moment with all the music, and then it cuts to a commercial and it's like kids dancing and drinking Diet Coke, and you're like, shit, now I want a Diet Coke. Shock on the nervous system suppresses the conscious mind. You stop thinking. As soon as you stop thinking, you're able to fire information into the unconscious mind. I don't like using that one. It's fear-based. People do use it. You'll probably see it more now. The second one is what I do like, is fascination. Fascination, let's just see it as, did you teach them something? Were you interesting in how you told stories? Were you engaging and thoughtful in the way that you wanted to help them? When someone is fascinated, as in like fascinated by a book or fascinated by a speaker or fascinated by a movie, they shut off all conscious faculties and information is pouring into their unconscious mind. And the unconscious mind is weird in the sense that it cannot reject ideas. There's no security guard in the unconscious mind. The security guard exists in the conscious mind. So if I am doing things to fascinate the brain and tickle the brain in a way where it engages just right with the right brainwave frequency, with fascination, with storytelling, with metaphor, then I'm able to implant ideas into their head, as in like, hey, when you eat this way for a prolonged period of time, you will be healthy. Again, this is level one. So the last one, if I'm trying to punch information into their unconscious mind, is agreement, micro agreements. You heard me do it earlier to you. Hey, is it okay if, are you open to, are you against doing those types of openings for the sentence where it actually positions you in a way where you're asking micro permission? We're not in a game of persuasion. That's the furthest thing from it. If you have salespeople telling you this is how you sell care packages, this is how you sell treatment plans, it's not selling, it's not persuasion. We're in a game of permission. And we're not in a game of permission of you doing something to them. We're in the game of permission of you giving them permission to choose themselves, to take care of themselves. Because largely, most of the people that are coming to our office have never actually chosen to take care of themselves. So if you are in the game of micro permission and micro agreements, and you escalate that over time, I call it the ascension triangle, then they were going to do bolder and bolder decisions to take care of themselves and therefore have greater outcomes. And the greater the outcome means the more people are going to ask what they did, or the more people they're going to tell because they're excited, and the faster and the bigger your practice will grow. So 3 ways to punch into the unconscious mind. Shock. I don't really like that one, but you can do it. You can scare someone with their x-ray. You can scare someone with their blood work. I scared that dude with the CRP of 60 a little bit. I'm like, bro, we got to get this down. You might have a heart attack. Like, sometimes you got to say it. I don't like saying it, but sometimes you have to. Fascination, teach them something. Third one, agreement, micro permissions. Are you open to, Are you against? Next time you're here, do you want to open that conversation that way? Micro agreements over time. You can learn to structure your language. This is something we teach. That way that they are going to naturally drift toward the order of becoming a more and more valuable patient and having a higher and higher impact on their life. If this interests you guys, this is something I'm actively doing. I'm helping offices install products and service lines that are in the regenerative medicine space. We're full service. There's a team of 6 of us. And we come in and we literally help install these systems, processes, and procedures, and even hire and train staff for you if needed, so that you are able to provide these services at a high value. My background, I've been a chiropractor for over a decade, multiple offices, sold offices, own 2 offices now. We have a medical and regenerative office in Brentwood, Tennessee, and we are acquiring our second one in Northern Alabama. And this is my passion. So this has changed my life, and I've watched it change thousands of patients' lives by extension. And I want to help doctors come into the future, because I definitely think this is the future of medicine. And I'm not the only one doing this. I think the doctors that refuse to change will be left. So people are looking for this stuff now more than ever.